Hello everyone, today we're addressing STIs because we do not want any more sexually transmitted infections, and if there is any available or around anywhere, we want it treated and properly treated to prevent the damage to your future reproductive potential. So let's go. So sexually transmitted infections are gotten through sexual intercourse, either through penetrative intercourse, anal, or even oral. So it's very important that it's properly treated because it could lead to more serious complications, that is problems in the future. So first, let's start from the basic signs and symptoms. It could just be nothing, particularly for men. You may not even know that you have any sexual infection. But for the women, it's usually because of the way our reproductive tract is, it's open. So you could start from itching to abnormal vaginal discharge, which is not like the normal one you have during the different phases of your cycle. That's your menstrual cycle. So it could be ranging from thick whitish to cloudy to greenish to different yellowish to different colors of vaginal discharge, and different colors connote different organisms that may have caused the sexual infection. So lower abdominal pain, itching, to pain during sexual intercourse, and also for men it could go as far as having a urethral discharge, that is discharge from their penile shaft, to see like having a normal discharge, or pain while trying to urinate, also for both men and females. So all of these things could be pointers to a sexually transmitted infection. And if you've been having casual sex, it's very important that you come in to get checked. The most important thing to do is to use barrier method really, so that this does not happen. We'll go to the preventions later in the video, so stay tuned, continue watching us. So those are the symptoms of sexually transmitted infections, like the basic things. So what do you need to do? Go into the hospital, see a doctor, let them take samples for investigation and give you the right medication for the right duration of time. Please make sure you complete your dose of antibiotics or whatever medication that you're given, antifungal, antiviral, whatever it is, because these are the things that can result to long-term complications like infertility due to a blocked tube, that's a blocked fallopian tube in the woman, or even infection in the scrotum that would result, we call it epididymal otitis. I know it's a lot of words. Infection that could even reduce the sperm count for men and subsequent male infertility. All of these are curable. All these infections are curable, so it's important to come in to take your medication, and also it is important to prevent these long-term infections. So it's very important that you come in early enough before you have long-term effects on your fertility potential. So some of these STIs are actually not curable. Some of them, like gonorrhea, chlamydia, other bacterial infections, are curable, but some of the viral infections may not be curable. For example, you get HPV virus through unprotected sexual intercourse, that's human papilloma virus. Your body can cure it. So the immunity in your body can actually cure it, over time, and then using of vaccines and all. But there are some times where the infection remains persistent, so much so that it can result in cervical cancer. Also, HIV can be gotten from sexually transmitted infection. So it's very important that you abstain if you do not, to abstain, and if you cannot, use barrier method and make sure that you and your partner are safe and clean. Another thing is, you can imagine hepatitis B can also be gotten through sexual relations, either from kissing or even from penetrative sex. So what do we need to do? Hepatitis B is a preventable virus by making sure that your vaccination is complete. So go into the hospital, check that you don't have hepatitis B, and if you don't, make sure you complete your vaccination so as to prevent the effects on your liver and future risk of liver. So later, turn on your notification buttons, subscribe to this channel, put up the likes and thumbs up for us so that we can give you more videos on this. So till then, have a lovely day. Bye.